Hello, this is Nadine the Gluten Free RN. Today we're going to talk about celiac disease in children. This is episode 6 of the Gluten Free RN podcast, and today we're going to talk about the all-important topic of children and celiac disease. We're going to throw in some gluten intolerance too for those children that don't actually have celiac disease proper, but are still affected by gluten. Again, welcome to the Gluten Free RN podcast, episode 6. Today we're going to talk about a very important topic to my heart, and as a nurse, I think it's extremely important that we talk about this topic, but we're going to talk about children and celiac disease. There's a number of reasons that this is extremely important to me as a mom and as a nurse and as a person in general who knows anything about celiac disease, is because a lot of children get missed with early symptoms, with things that people just want to consider to be normal or normal for that child, when in fact, those signs and symptoms are actually issues that could be picked up early on as celiac disease signs and symptoms. Because believe it or not, a continued exposure to gluten has lifelong effects, not only to that child, but the entire family. So ideally, we're going to catch children at a very young age, and even more ideally, we're going to get to parents before they get pregnant so that we can actually identify the celiac disease, get the mom on a gluten-free diet, correct the nutritional deficiencies, and get her healthy enough so that the mom can actually support a viable pregnancy or a healthy child. Because gluten can cause problems even with a developing fetus in the womb or in the uterus. So celiac disease, when it's undiagnosed, has a profound impact on fetal development and maternal health. It's been noted by the University of Chicago Celiac Disease Center that there's a number of children that are undiagnosed. It takes on average for 9 to 15 years for a person to be diagnosed correctly. And I say if ever, because a lot of people fall through the cracks. And there's huge cracks in the United States for getting diagnosed with celiac disease. So a lot of these children present with interesting array of symptoms, but for the most part, it's considered that children will present with what's considered the classic form of celiac disease, which would include failure to thrive, low birth weight, short, stunted growth, delayed development, diarrhea and or constipation, abdominal pain. And believe it or not, a lot of doctors will tell parents or moms especially that they should just expect that their child is going to complain of belly aches and abdominal pain, and that we really just don't know what causes it. Really, if you're not testing for celiac disease, then that's not true. That's just telling the mom and the child to pretty much, live with it, which is a hard thing to tell somebody if that pain occurs every day with whatever they're eating. And if they're eating a regular diet or a standard American diet, which is SAD, by the way, SAD, then they're not given the opportunity to actually grow and develop not only their body, but their brain. So really what we want to do is prevent these kids from suffering anymore, because a lot of the children will present with a varied array of signs and symptoms from an early age. And typically those signs and symptoms will just continue on, and they'll get worse or they'll change until it's actually recognized that celiac disease is what is causing all of those signs and symptoms. So even me as a child, a long, long time ago, my signs and symptoms were abdominal pain, constipation with varied diarrhea, and canker sores, which my mom always told us was because we use swear words. And that's not really based in any science. Not only is it not based in any science, but I can assure you I still use some swear words, but I don't have canker sores anymore since I took gluten out of my diet. So dentists should be looking for celiac disease in children with canker sores, dental enamel defects, or bleeding gums, especially because that tends to be a vitamin K deficiency. And the same thing goes along with nosebleeds. If your child spontaneously gets a nosebleed, it's typically not because it's dry air outside or whatever other reason parents are given. It might actually be a vitamin K deficiency, which is a fat-soluble vitamin, and very, very important in clotting of blood. So what other symptoms can a child show up with? Well, there's anemia. So chronic anemia, which is another thing that I had. And I was told it was because I had red hair that I was chronically anemic. And because a lot of people with red hair apparently are anemic. And so then I have to say, well, are most of those people with red hair that are anemic also celiac? And at this point in time, I would say probably yes. But a lot of these children are anemic, and despite taking iron tablets, they can't absorb it, which is the problem with eating food and having a damaged immune system. When they have damaged intestines, they take the iron pill and they can't absorb it because their intestines are damaged. That happens a lot with supplements and vitamins and minerals. When people actually take supplements because they realize they're deficient in some of them, it's because they can't absorb them, that they can't pull up the blood levels. So even if people are eating correctly and they take vitamins and minerals and supplements, if they're not absorbing them, that's the main issue, then their body can't utilize the supplements, can't utilize the vitamins and minerals. So children will present with, a myriad of signs and symptoms. Some of those can be focus issues. They'll say they can't pay attention, they're easily distracted, they have a hard time retaining information that they learn while they're reading or in school. So they have to do things over and over and over again. Some of these kids get labeled as ADD, ODD, ADHD. Some of them are even put on medications without being tested for celiac disease. And I think that these children are done an enormous misservice by placing them on medications without actually testing for celiac disease first. So short stature, there's a study out of Italy that actually determined that 90% of the short children had celiac disease. That's an astounding number. But the reality is that if you do not have the correct nutrition or if you're malnourished, then you cannot grow appropriately. Now, my friend Katie, who actually worked for me for a period of time and is referenced in my book, Donation, A Nurse's Memoir of Celiac Disease from Missed Diagnosis to Food and Health Activism, Katie's story is actually in my book for several very good reasons. Number one, she had her colon taken out at the age of 19 after lifelong abdominal pain, constipation, and just being in the emergency department all the time. They took it out because she had a megacolon. Well, she had a megacolon because she had chronic constipation because she ended up having celiac disease that had been undiagnosed. Constipation is a neurological disorder. Despite what you may hear or read, it's not a lack of fiber and water. It's actually a neurological disorder. You have an enormous component of your neurological system in your intestines. And when that gets damaged or paralyzed, you cannot have peristalsis, which would then push the stool or the fecal material through your small intestines to your colon. So Katie actually ended up with a megacolon, had her colon taken out, and did not get any better. She was in her last day at nutrition school before she graduated, and one of the nutritionists from Salem Hospital came down and gave a talk on celiac disease. Her name was Denise Cedar, and she's a very well-established registered dietitian and educated in celiac disease. So she came down, gave a talk, and Katie said, "Oh my gosh, that's what we have. That's what my whole family has, not just me. We all have celiac disease or gluten intolerance." So she went home, got herself tested through Interlab, and lo and behold, Katie came back positive, went on a gluten-free diet, and got significantly better. Now, Katie is about 5'3", but she has a size 10 foot. Honestly, that doesn't make any sense. Katie should be about 6'2", but her growth was stunted due to the fact that she was malnourished as a child. Not because her parents didn't feed her. It's primarily because she was not absorbing any nutrients, despite eating very well. So Katie is much better now on a gluten-free diet. She is actually a DO, so she's a doctor. She practices, takes care of other people. Whenever she does get gluten, it really, really is quite debilitating. So if Katie would have known at a very young age, number one, she would have grown to her predetermined height, which would have been much taller than 5'3". And despite being, just a go-getter, type A personality, fabulous woman, having undiagnosed celiac disease made Katie's life a lot more difficult than it had to be. So that's a good example of short stature. Focus issues, like I mentioned earlier, and a lot of kids have focus issues and we think they're just not paying attention, but gluten has a huge impact on our neurological system, which is our brain. So celiac disease is primarily a neurological disorder. So these children really have hypoxia, which is caused by inflammation of the brain. So hypoxia being low oxygen flow, and it's vitally important that your brain actually get oxygen. If you have inflammation, which causes swelling, and you end up with hypoxia, then your brain actually can't function correctly. Some people refer to this as brain fog. Eating disorders or picky eaters. There's a great book out called How Doctors Think by Jerome Grootman. He's an MD. If you just read the introduction to that book, which I also reference in my book, I think it's a fascinating example of how people get missed year after year after year, treated for all kinds of other things, including psychiatric disorders. But what we're finding is a lot of these people actually are celiac disease and they're never tested and never diagnosed correctly. So the big push, of course, is to get people tested correctly, diagnosed, and always given the option to go on a gluten-free diet to see if it helps. Because really, we don't know if a gluten-free diet will help, whether the tests are positive or negative or not, unless we try it. And that is a very viable option and it's relatively easy. It's much easier than having to go through surgeries or be on multiple medications for years before finding out that, just taking a thing out of your diet. For some of us, it's all grains, and then you get better. Anger issues, again, that inflamed brain. Diarrhea, I want to touch back on this because it was a very common symptom that doctors would pick up on in the 1920s, 30s, 40s, and 50s when children did have diarrhea. And they had a big bloated belly, and they had stick arms and legs, and sunken eyes. Those kids were pretty easy to pick out. And honestly, some people still send me pictures of children in this day and age that look like that. And they say, "What do you think?" And then I have to respond, "What do you think? Do you think that child looks like they have celiac disease?" Because if they look like they have celiac disease and they have any of those signs and symptoms, well, best to get them tested first, always for a baseline, and then opt to go on a gluten-free diet, whether the tests are positive or negative. There is no downside to going on a gluten-free diet. Speaking of diarrhea, I did have one 16-year-old who came into my office for a consultation with her mom, and she said she really didn't know what a normal stool looked like, what a normal poop looked like. We talk about poop a lot in my office. She thought everyone had diarrhea every day. That was her perception of normal. She didn't think it was abnormal. So she went on a gluten-free diet and suddenly she's having normal bowel movements. And that's extremely important. Interestingly enough, I have some children that are urinary incontinent. I also have some that are fecally incontinent, which means that they cannot hold their stool, their poop. And so they actually are incontinent of stool. And that's socially debilitating. And a lot of these children, unfortunately, have, again, never been tested for celiac disease. And it's not a behavioral issue. It's nothing but their bodies attempt to get rid of a poison or a toxin. Some of my kids actually, 18, 19, 20s, start to exhibit symptoms of psychiatric disorders, including schizophrenia, hallucinations, all kinds of typical signs and symptoms of schizophrenia. and early mental health disorders. Some of these kids, we can get them on a gluten-free diet and they do much better. I'm not going to say that all of their symptoms go away or they get completely better, but a lot of children regain their brain and they go back to school and they do fine. There's also some of the people in my town that and that I've worked with over the years that have been diagnosed with schizophrenia really since before I was born, have gone through horrible treatments for mental health disorders, including electrical shock therapy. And they go on a gluten-free diet, and even in their 50s, 60s, and 70s, they get better. They regain some of their brain function. Now, we can't completely undo all of the damage that's been done, not just from exposure to gluten, but from some of the medications and some of the treatment plans. There's side effects and complications. But when somebody actually gets their brain function back enough to go back to school and succeed in that, even at a later date, that's a profound failure of our system to not have tested people correctly or even suggested a gluten-free diet as an option. So delayed puberty, I'm going to talk now about Sam. She's another woman that worked for me for a period of time, and I love Sam. She actually looks a little bit like she could be my daughter. When Sam was 17, she was overweight. She was in high school. She hated everybody. She hated her teachers. She argued with her parents. She was overweight, red hair like me. That's why I say that she and I are mistaken for mother-daughter. And her skin was all ruddy and broken out. She had abdominal pain all the time. She was still wetting the bed at 17 and hadn't gotten her period, by the way. But all these things were considered normal, that she would get them when her body was ready, and she would catch up and she would stop, she would mature at some age. So obviously all of these signs and symptoms were quite distressing to her family and to herself, by the way. So lo and behold, her sister got diagnosed with an ovarian cyst that was about 20 pounds, which is enormous. So she had surgery to take it out, and at the same time got diagnosed with celiac disease. So when Sam's sister got diagnosed with celiac disease, you would think that the rest of the family would get tested and hopefully diagnosed correctly at that point, because celiac disease is genetic. So it runs in families, and very often we find multiple family members that have celiac disease. So once someone is identified in a family as having celiac disease, the rest of the family automatically has to get tested, pretty much whether they want to or not, I guess. So children have to get tested appropriately. And then if they come back positive, the rest of the family has to get tested appropriately and very quickly. So we can't forget to test the rest of the family because it is a genetic disorder. So first, I would suggest that the DNA status or the genetic status get tested on every family member. And then from there on, everybody get tested for celiac disease with a celiac antibody test or a biopsy. It should be determined by that person and the doctor how they're best going to get tested for celiac disease. So Sam wasn't tested until she went into her doctor's appointment and basically sat down in the doctor's office and said, "I'm not leaving this office until you test me for celiac disease." And the doctor said, "Well, I'm not going to test you." And Sam said, "Well, that's fine. I'm not leaving your office." And so the doctor finally acquiesced and he agreed to test Sam for celiac disease. And lo and behold, it came back positive. And the first question out of Sam's mouth was, "Hey, I work in a pizzeria. Is that okay? Can I keep working at my job?" And the doctor said, "Sure, fine. It's no problem. Keep working." And that was a very bad answer. So Sam did get better on a gluten-free diet when she was eating gluten-free, but she continued to work at the pizzeria. That's environmental exposure to gluten. That gluten is in the air. The flour is in the air for up to 72 hours. And she's breathing it in. It's on her skin. It's in her respiratory tract. That's a very bad idea for Sam to have continued to work in the pizzeria. So unfortunately, sometimes I have to recommend that people get a new job. Sam's new job was to come in and work at the Gluten Free RN office. So I had to rescue her from the pizzeria, which I'm extremely happy as she came to work for me because she was an amazing employee. And not only that, but she continued to get better. She lost 100 pounds, her skin cleared up. By the time she left working in my office, she looked like she was a model. Physically beautiful, just a sparkly, light personality, amazing researchability, and brilliant. So Sam got married, and despite the fact that they had told her she wouldn't be able to have children, ended up having 2 children. She now has Wes and Cooper, absolutely fabulous children. Wes, by the way, walked when he was 7 months old. He's a paleo baby, which means Sam, was on a gluten-free, dairy-free diet for a while. Most of us in the office went on a paleo diet or our variation of a paleo diet. Sam's pregnancies were all completed while she was on a paleo diet. And those children developmentally are just stunning. I always say that they're extra shiny and sparkly children because they developmentally and socially, they interact on a different level. It's amazing to watch. Now, I'm a nurse from the emergency department, old school, and I pay a ton of attention to how well children are developing and what their skill level is and how well they speak. And every determinant of child development is extremely important. And Sam's kids are amazing. Now, Sam is a diagnosed celiac. Her children have never been exposed to gluten, and Sam's going to maintain that. And just assuming that they, at some point in their lives, will develop celiac disease if they are exposed to gluten. So not exposing them to gluten is completely preventative for so many health issues. And it's interesting to note that the University of Chicago Celiac Disease Center also noted that in a landmark prevalence study on celiac disease, investigators determined that 60% of children and 41% of adults diagnosed during a study were asymptomatic. And that means that they truly had no symptoms. They didn't have anything that they were complaining of at the time. So roughly 50% of the population that has celiac disease would say they have no symptoms. That's really interesting. So why is it important that we actually diagnose these children? Because another interesting study that was in 1999 at Ventura, and again, this is also on the University of Chicago Medicine Celiac Disease Center website, found that those children that were diagnosed between 2 and 4 years of age had a 10.5% chance of developing an autoimmune disorder. If they were diagnosed with celiac disease at the age of 4 to 12, they had a 16.7% chance of developing an autoimmune disorder. If that diagnosis was delayed until the age of 12 to 20, the chances of developing another autoimmune disease leapt to 27%. And any time over the age of 20 was 34%. So that's an enormous increase in a risk of developing any other autoimmune disease. If you take into account that that's type 1 diabetes, please understand if there's any way that we can prevent children from developing type 1 diabetes, which is insulin-dependent diabetes, we should be actively searching for people that are HLA, DQ2, and or DQ8 positive so that potentially we can preventively put them on a gluten-free diet so that they decrease their risk of developing any other autoimmune disease, including type 1 diabetes. That should be our number one goal. As a nurse, I think that it's appalling that we're not testing people, even just at birth, doing a genetic study to see if they're predisposed genetically to develop celiac disease. So people have that information. We're actually keeping very important health information from people if we're not teaching them about gluten intolerance and celiac disease. Because type 1 diabetics affects 3 million people. According to this old data, 6% of those diagnosed also have celiac disease. So there's an enormous genetic overlap between type 1 diabetes and celiac disease. I used to say that every type 1 diabetic child was tested for celiac disease every year at every endocrinology center across the United States, because that's what was actually mentioned at several of the conferences, because the genetic overlap is so large. But when I actually talked to parents of children with type 1 diabetes, I'm finding out that that is not at all the case, that these children are not getting tested for celiac disease every year, nor are they getting tested correctly with an entire celiac panel. What we are finding is that a lot of these children are IgA deficient, which means that they don't produce enough IgA or immunoglobulin A to actually mount an immune response that would result in a potentially positive celiac panel. So if your child is IgA deficient, then that test cannot be positive. So if you have any questions about the testing, please contact me or send me an email at nadine@glutenfreern.com. I'm happy to schedule an appointment or a consultation for you or your family and review the lab work that's already been done, or to suggest lab work that should be done for children so that they can get diagnosed correctly. Please keep in mind that children younger than 2 to 3 years of age are difficult to test for celiac disease because they innately have an immature immune system. But if their test is positive, then they're most assuredly in. But what we find is that because their immune system is immature just by virtue of being young, then a lot of those tests look like they're negative, but the child is actually exhibiting signs and symptoms of celiac disease. And if you have a baby that is colicky or gassy or has projectile vomiting or any sign or symptom that is concerning to you as a parent, like not growing or low birth weight or failure to thrive, please make sure that that child is tested or that the mom and dad themselves are tested for celiac disease, especially if the mom is breastfeeding. A child will be colicky with things like dairy, but because the gluten and the dairy protein are very similar, you might hear it referred to as a gluten-free, casein-free diet. That baby is potentially reacting to both the gluten and the casein or the dairy protein. So the mom typically would have to remove both the gluten and the casein from her diet. Let's just review some common signs and symptoms of gluten intolerance and celiac disease in children. Failure to thrive, short stature, diarrhea and or constipation, vomiting, ADD, ADHD, ODD, autism, eczema, psoriasis, lactose intolerance, muscle wasting, delayed puberty, dental problems, bedwetting, stomach pain, excessive gas, or any gas really, that is troublesome or bothersome, distended belly, belly aches, fatty stools or stools that float. That's known as steatorrhea, and that's how children in the 1920s, 30s, 40s, and 50s used to be diagnosed or identified with celiac disease because they would have fatty stools. And what that means is that they could not or weren't absorbing any fat in their diet. And if you don't absorb fat in your diet, you cannot absorb your fat-soluble vitamins, which are A, D, E, and K, and extremely important for neurological development, your brain, and every other cellular function in your body. And then, of course, weight loss or weight gain. A lot of the people that are overweight, including children, are not eating too much food. It's that they're eating a lot of food that they're not absorbing, and that obesity or that putting on all that fat is cheap energy. I used to call it crap fat, which means it was just weight that I could not lose no matter what I did until I went on a gluten-free diet, because my body, that's a starvation state, by the way. So a lot of these people that are overweight or grossly overweight or morbidly obese are probably celiac and they're misdiagnosed. So what we want to do is make sure that these kids get tested appropriately at an early age, and the earlier the better, or have the moms get tested. Actually, the moms and the dads get tested before a pregnancy actually occurs to make sure that the optimal health is in place before the mom gets pregnant and can actually sustain a pregnancy. Because what we find is that if a mom is undiagnosed, she is at increased risk for miscarriages, low birth weight babies, neural defects such as spina bifida, and all types of pregnancy complications. And a gluten-free diet that is nutrient dense is one of the healthiest diets in the world. We like to think of it, as a paleo diet or whatever, but really what we're eating is whole food that is good for us, that is nutrient dense. So look at your food. Is it nutrient dense? Does it have a lot of nutrients in it, pound for pound? Or is it gluten-free food that is not going to provide you with any nutrients? And those things have to be taken into account also. Is it still a high carbohydrate, high glycemic index food that you're eating or that you're craving? Then maybe there's some other issues we need to deal with also. But these kids really have a ton of food to eat. And it's not a deprivation thing to be on a gluten-free diet or a paleo diet. There's a lot of food that is available, and it's a perception issue. And kids do great at camps. There's even specialty camps for children with type 1 diabetes and celiac disease alone, and other food issues. Birthday parties, school events, camps, they all can be very easily navigated with some communication, pre-planning, and really just some positive affirmation that this is all going to be okay. Do your homework as far as the testing. Don't assume that your child is not going to have celiac disease because they don't have any symptoms. Again, 50% of people that would say they have no symptoms actually have celiac disease. So please just get yourself tested. There's no downside. And if you need help, please contact me, Nadine Griskoyak, the Gluten Free RN. I'm easy to find. You found me on this podcast, Gluten Free RN Podcast. I'm on Instagram, Facebook. You can find me at www.glutenfreern.com. And again, there's lots of resources out there. Make sure you're getting the best information. And this is episode 6 on children and celiac disease. Stay tuned for next episode on the elderly. We're going to make a major leap and go right from children to the senior population. So next episode will be celiac disease and the elderly population, which I'm quickly approaching myself. So I'm very just inherently interested. These are a lot of the people I work with, and I've found a number of people that were diagnosed with many other things and never tested for celiac disease. Once those people go on a gluten-free diet, it seems like miracles happen. So we'll talk about that next episode, episode 7 of the Gluten Free RN podcast. Until then, have a good day and remain gluten-free.